Okay, so this is the second class on headache, right? So in the first class, we learned how to identify tension headache, migraine, sinus headache. In this class, I picked the three most popular headaches, and we're going to discuss the drugs we use to manage them. So that anytime you go to the shelf and you see these drugs, you know that this kind of headache is what we use to treat, right? So let's go. My advice for you is, as I keep calling these drugs, please go to the shelf and pick the drugs and look at it, right? Because it is going to aid your remembrance. So the first type of headache is the tension headache. This is the most popular headache, the one in front of the head that everyone uses. And these are the drugs that we use to treat headache. So we have acetaminophen. It is called, this is your paracetamol, right? It is used for frequent mild to moderate headache. Then we have your NSAIDs, your ibuprofen, your diclofenac, your naproxen, your piroxicam, right? They are used to treat inflammation and pain. So any headache that has to do with inflammation, you can give any of these drugs. Then finally, we have combination pain relievers. So we have combinations of acetaminophen, diclofenac, we have acetaminophen, caffeine, right? We have combination pain relievers. We also have prescription medications. Although for prescription medications, you are not allowed to prescribe them, right? So you only the pharmacist is allowed to prescribe them. So we have tricyclic antidepressant like amitriptyline, right? And then we have skeletal muscle relaxants used for chronic cases. The second is sinus headache. If you remember sinus headache, um, the headache that is caused in the sinus, in the middle of the nose and the eyes. That's where the sinus is. So we use these drugs to relieve sinus headaches. So over the counter that you can prescribe are, of course, your NSAIDs, like diclofenac, ibuprofen, naproxen, and your acetaminophen or paracetamol, right? Number two is decongestant, right? So drugs like pseudoephedrine and phenylephrine, are used to decongest the nasal passages or the sinus. We can also use antihistamines like cetirizine and loratadine. We have nasal sprays like fluticasone, and we have saline nasal sprays like netipods. Then finally, we have prescription medicines for sinus headaches, right? So you can use antibiotics for sinus headaches, like Augmentin, and then we can also use triptans, like amitriptyline for sinus headache. Important considerations are drugs like oxymetazoline, they are called decongestants. Then finally, to migraine now, the very, very tough headaches at the side of the head. We have two kinds of treatment. We have the abortive treatment and we have the preventive treatment for migraine. So to cure migraine or to abort migraine, we use the triptans, like sumatriptans, rizatriptans. Number two, we have OTC medications like Excedrin. We can also use combinations of acetaminophen, aspirin, and caffeine. You can also use ibuprofen or naproxen. Number three, we have dietams like laspiditan. Number four, we have ergotamine, the ergot derivatives. And number five, we have anti-nausea drugs like metoclopramide and prochlorperazine, right, to relieve migraine. Now, to prevent migraine, for people who usually have migraine and you want to prevent them, we use blood pressure medications like propanolol. We can use antidepressants like amitriptyline. We can use anti-seizure drugs like topiramate and CGRP inhibitors like Erunumab, Erenumab. But don't forget that these preventive medicines are supposed to be prescribed by the pharmacist only. Thank you.